We've got some really good questions from our audience that we want to get to, too. We'll get to as many of those as we can right now. First question, when we're talking about average annual salary for small employers, are we using base salary or base plus bonus?
Right. Is this for the tax credit calculation? For that purpose, it will include bonuses. So the only thing the IRS had on their website was the good news. That was about the tax credit. They didn't have anything else on their website yet about health care. But they at least did address that point, that it basically, you look at the person's W-2, and that W-2 would include year-end bonuses, commissions, that type of thing.
Okay. Another question, how do you determine the value of the plan included on the W-2 for a partially self-funded plan?
Great question.
Yep.
That's a CPA question.
CPA question. Great.
That's Clinton's.
That's Clinton. Well, we hope regulations come out between now and when we start to have to do that, but we have to do that pretty soon. My guess is there would be some kind of calculation that would say, here's what we're paying for health insurance, and here's what we as the self-funded portion believe we allocate to each employee, and then put the two together, and that's what you report. That's strictly a guess on my part.
Do you think that the COBRA equivalency might come into play in terms of that valuation?
That would probably be a good place to start.
Might be a benchmark for self-funded plans.
Yeah, that'd be a very good benchmark.
Another question, will employers with fewer than 200 employees be able to auto-enroll employees?
I think in simplest terms, you can always do better than what the law mandates you have to do. The mandate is relative to employers over 200 in requiring them to auto-enroll. I think as an employer under 200, should you choose to take that approach, I don't think there's any restriction that would prevent you from doing that.
Can they enroll in the most basic option? As part of that? They can. Okay. Mm-hmm. We move on with our next question. What percentage of health care costs are employers required to cover in 2014, 50-plus employees?
The statute provides for employers starting in 2014 to have 4 different plans, a bronze, silver, gold, and platinum. Somebody went to the Olympics. But and each of those is defined as paying a certain percentage of typical claims. And so that's something that's pretty fuzzy right now, and I think as we get closer to that, we'll have more instruction on what each of those plans requires. So you will be required, if you're an employer offering a plan in 2014, to have those kinds of levels of plans. Those are also the same levels that will have to be provided through the insurance exchanges.
Bill, go
ahead.
I'm sorry, on a totally different question, but for the tax credit, the employer has to pay at least 50% of what would be the equivalent of single coverage. I don't know if they will extrapolate that and then apply that to the larger employers, but on the smaller employers, the employer has to pay 50%.
Okay. We talked about menu labeling before. When does that go into effect again? Somebody was wanting to know about that.
That's in effect right now.
It is. Somebody thought that was January 2011, but that's in effect right now.
That's when that's up and running now.
All right. Did we say that even grandfathered plans will be subject to no employee payment for preventive care? Is that 2010, 2011?
Under the grandfather provision, that is one that grandfather plans could exempt themselves from compliance with. So as long as you maintain grandfather status, the mandate for first dollar coverage for preventive care services, which, by the way, the laundry list of services hasn't been issued yet. But the mandate you could exempt yourself from if you have grandfather status.
Okay. An employer covers both union and non-union employees on the same medical plan. Is the same anniversary date upon contract expiration, does that apply for both employee groups?
As I mentioned, the statute specifically addresses the collective bargaining unit employees and says the effective date of the statute is delayed until after that expires. But I don't think that would apply to non-bargaining unit folks who are just being treated similarly. I think you probably have to go ahead and use the effective date of the statute for those people.
Okay, another question. Is a small employer eligible for the subsidy if they already provide the total premium, or is that just for new companies now participating?
That would be the tax credit. So I've not seen anything that requires someone to be off of a plan and to come onto a plan for the subsidy, for the tax credit. So I believe that if they currently provide health insurance, then in 2010 they'll be able to claim tax credit.
Yeah, it's just a little different because it's maybe confusing because in the state of Kansas, there has been the availability of tax credits for a number of years, but the criteria in the state of Kansas is you cannot have had a health insurance plan in place for several years prior to implementing a plan in order to receive the credit. There doesn't appear to be anything in the healthcare reform regulations at this point that has a stipulation or a restriction such as what's been in place in Kansas.